Enforcement Director has now issued a lookout circular against the former Minister P. Chidambaram. He has remained untraceable through the night since last evening. Supreme Court bench headed by Justice N.V. Ramana has sent the petition further up for urgent hearing to the Chief Justice of India. There is still no relief until the Chief Justice of India takes a final call, a final decision on Chidambaram's plea. There are 6 people, including a senior priest, who've been booked for defamation and character assassination of Sister Lucy, one of the nuns who had openly spoken out against rape-accused Franco Mulakkal. The Madras High Court has asked for a Tamil Nadu government response after an amicus curiae report finds ecologically sensitive Pallikaranai marshland that has been encroached upon by central government buildings, IT companies and residential complexes as well. Residents in Bellandur Lake, which is in Bengaluru, have now taken to the streets and formed a human chain against authorities in approving new constructions. The residents here complain of traffic snarls because of the incessant construction. You are with the big story here this afternoon. I'm Seher Zama. Today we are focusing on a shocking case that has come in wherein which a woman was forced to deliver her baby in the corridors of a government hospital. 34-year-old Sanjo, who was brought to the Ram Manohar Lohia hospital on late Sunday night, but the hospital staff then told her there were no beds available. They turned her away instead of admitting her. She then had no choice, delivered on the floor of the hospital corridor. Now, taking cognizance of this matter, the district magistrate has now ordered a probe, warned strict action against those who are found guilty.
उनके द्वारा संज्ञान में लाया गया, लेकिन इस तरह की ये घटना जो है गलत घटना है और इस पर प्रभावी कार्रवाई की जाएगी। वहाँ पे पूरी जांच करा के और जो दोषी होंगे उनके खिलाफ उसमें बिंदुवार जांच कराई जाएगी और जो दोषी होगा उसके खिलाफ
से ये जानकारी प्राप्त हुई थी कि उसमें इस तरह का प्रकरण संज्ञान में आया था, तो उसमें स्वतः संज्ञान लेते हुए जो है इसमें जांच के लिए जो है अधिकारियों की टीम गठित कर दी गई है और इसमें यथाशीघ्र रिपोर्ट मांगी गई है। इसमें जो भी दोषी कर्मचारी होगा या जो भी घटना की सत्यता होगी या असत्यता होगी, जिस भी तरह की स्थिति होगी, तो उसमें अगर कोई लापरवाही दिखाई दे तो उस पर कार्रवाई की जाएगी।
The question that we're asking here on why various government schemes, be it state government schemes, several flagship central government schemes here as well, specifically for the benefit of expectant pregnant women not working on ground. Let's throw this open to our panelists with us. We have Ms. Anila Singh, spokesperson of the BJP, Dr. Ravi Malik, CMD of the Radix Hospital. First to you, Anila, there's a huge glaring lapse here on ground. Would you think that aspects of the Ayushman Bharat, which is meant to benefit pregnant women, not working? There is also the PMSMA, which is the Pradhan Mantri Surakshit Matritva Abhiyan, which is either not working on ground. There is still no upgradation of hospital infrastructure here.
Seher, because of this one particular incident, you cannot say that the various social schemes meant for the new mothers or the pregnant women or for the infants are not working on the ground. Indeed, what happened It was not correct, and there were reasons behind it, and the action probably will be taken against those who were responsible for it, because at least they should have checked that in which state she is before asking her to stroll in the corridor. Definitely they have done wrong and they'll be punished for that. But at the same time, if we talk about Uttar Pradesh, I can say that when we came, after that, there is much improvement in the health condition. It was rotten. When we came, it was rotten. But definitely, it's a huge state with the humongous population. It's a Herculean task, but Yogi Adityanath ji is definitely trying, and to reach all the people living in the village as well through PHCs, CHCs. But yes, we are working, and much more has to be worked.
Right. Dr. Malik, would you like to respond to that? Because this is, interestingly, the same hospital which was under the scanner a few years ago, wherein which about 49 infants had died as well, where the parents complained that it was because of lack of medicine, lack of oxygen, at the same time where you had the encephalitis outbreak.
As a pediatrician, I can tell you, it is a case of gross medical negligence, because you cannot refuse a lady who is already undergoing the labor pain, and it is a very pathetic situation that the lady is delivering in the veranda. I must tell you that labor is a very high risk situation. During this situation, even postpartum hemorrhages can occur, the lady can even die for that matter, and even the baby, if he doesn't take a first breath within 5 to 10 minutes, even a brain damage can occur to the baby. So by and large, it is a very, very pathetic situation. It is a careless attitude, whatever of administration of the doctors over there. It is not at all acceptable by any standards. So I'm really shocked to see such a kind of affair, because when a lady is during the period of labor, when she is going to the doctor, lot many professionals are required, not only the midwife, nurses, but also a pediatrician, also a gynecologist, and with of course set of instruments to deal with any kind of emergency. And we need to have an availability of oxygen, that to 2 points of oxygen at that time when the delivery is happening, because anything can happen to the baby and the mother. So it is very important. It is a pathetic situation.
But Dr. Malik, is this the same issue that we've discussed in the past as well? In promises that were made with respect to the Ayushman Bharat scheme, and promises that were made with respect to the PM SMA scheme here, specifically having pregnant expectant women as beneficiaries to this scheme, that there is still lack of infrastructure on what is being promised. We've looked at Ayushman Bharat being there on ground for the past year and a half. On what has been promised cannot be delivered on ground. In this case in point, in the hospital, where the hospital said, we don't have any beds. Sorry, you need to go away.
This definitely shows the scarcity of the medical personnel, the lack of infrastructure, and the kind of attitude what the professionals have towards the patient. So it shows lot many things. It also shows that there is the ratio between doctor and patient is less, the bed available for the patients, they are very less. And as far as the Ayushman Bharat scheme is concerned, of course it is a very good scheme, but I must tell you that if you need to give medical care to 10 crore of families, 100 million people, if you are 100 million families you want to give care, you need to have a very, very strong infrastructure. You need to have very strong primary health centers. As I've come to know, this is the only big government hospital in whole Farrukhabad. So I don't think that with this kind of an infrastructure, it will be little difficult for us to implement the Ayushman Bharat scheme.
Ms. Anila Singh, please respond to that. We're looking at several months down the line here, wherein which even primary healthcare centers, this is a specialty government hospital center there in Farrukhabad, where there should have been upgradation of infrastructure. This was the same hospital under the scanner where about 49 infants had died, allegedly what the parents said during the time of the outbreak of encephalitis, for lack of oxygen, for lack of medicines. 2 years down the line, there has been no improvement. How do we say that the UP government has worked immensely on this health sector in the state?
Seher, as I told you earlier also, that the population targeted here from health point of view in Uttar Pradesh, that is huge. And when we came into power, the health infrastructure was rotten, not even bad, it was rotten. Like doctors were not there in the PHCs, in the CHCs, government hospitals were in very bad condition. I mean, if we talk about paramedic staff, even that was not available. So there were many things on which government had to work. Government is working. If we talk about Ayushman Bharat, I mean, till date, more than 6 crore families have been benefited by this scheme, if we talk about Ayushman Bharat. And secondly, if we talk about the vaccination, as you were mentioning that this is the hospital where infants had died because of the encephalitis, then let me tell you, even in the, I mean, this year till date, more than 25 lakh infants and children, they have been vaccinated under Indradhanush scheme. So it is not so that the government is not working, but if we talk about this particular case, yes, it was indeed a very callous attitude, and it is shocking also. I mean, the hospital had, he or she, whoever the person is, he has to answer, because if the lower staff is not working properly, then the head is responsible, and the inquiry report will be submitted very soon, and those who are guilty, they will be punished as well. Because if we talk of whether we talk about the central government or whether we talk about the state government of Uttar Pradesh, like both the governments, they I mean, for them the health of the pregnant women or the new mother or the children or infants, that comes to the priority, because it is Modi ji who enhanced the maternity leave, because he understands very well that what type of time a woman requires for her newborn baby, and there are various social schemes where the pregnant women are given nutritious food, and even after the delivery as well. So we are working on it, but yes, such incidents should not happen morally, medically, on any ground. Ethically,
Right.
it is absolutely incorrect, and the doctor should have been more responsible.
Right. Dr. Malik, what kind of a penalty here? None of the existing schemes wherein which... yes, Dr. Malik, is my voice going through, please? Okay, we're going to be reconnecting with Dr. Malik on that in just a bit here. But Anila Singh, it seems that because these are flagship programs here, as far as the central government's commitment to improving health infrastructure, medical services provided to citizens, particularly those belonging to below the poverty line or the lower middle class here, to be provided affordable health and affordable medical infrastructure. Anything within the schemes here wherein which also works as a deterrent. If you have a certain hospital, a big hospital such as this in Farrukhabad, which in fact is not providing what has been promised by the government, what works as a deterrent there to the medical practitioners? This is a huge lapse. This is a huge mistake. It's going to be taking a while for investigations to go into this here as well. But a deterrent in the form of a penalty.
I am absolutely not denying that what happened in the hospital was not wrong. It is absolutely incorrect, and on all grounds it is incorrect, and definitely your worry throughout the discussion I've experienced, and I have felt that your worry is that if a big hospital like this one shows such carelessness towards the patients, then what about the units which are far off in the rural areas? And definitely I can say this,
right,
that when such incidents come across, then the punishment should be exemplary, which will be given definitely for so. And let me tell you, if we talk about the present day government in Uttar Pradesh, like more than 15 medical colleges they are in making almost, I think so, two aims are being built. Many effort, many steps are being taken to strengthen up the health infrastructure. But at the same, because I think health is the basic right of every citizen. Like education, I think health is a basic right, and it should be given in a very proper way, in a very, very proper way. And citizens like us, we pay taxes, so that such infrastructure should be built, and the services should be provided to the rural patient, poor patient, in a proper way and in a humane way. And the doctors or the officers who do not know how to do their duties, they have to face the punishment.
Dr. Malik, does that sound as a good enough assurance that there will be an inquiry, there would be action taken? Because this is one of the basics that a hospital should be providing.
अभी ये प्रकरण आप लोगों के द्वारा संज्ञान में लाया गया, लेकिन इस तरह की ये घटना जो है गलत घटना है और इस पर प्रभावी कार्रवाई की जाएगी। वहाँ पे पूरी जांच करा के और जो दोषी होंगे उनके खिलाफ उसमें बिंदुवार जांच कराई जाएगी और जो दोषी होगा उसके खिलाफ
से ये जानकारी प्राप्त हुई थी कि उसमें इस तरह का प्रकरण संज्ञान में आया था, तो उसमें स्वतः संज्ञान लेते हुए जो है इसमें जांच के लिए जो है अधिकारियों की टीम गठित कर दी गई है और इसमें यथाशीघ्र रिपोर्ट मांगी गई है। इसमें जो भी दोषी कर्मचारी होगा या जो भी घटना की सत्यता होगी या असत्यता होगी, जिस भी तरह की स्थिति होगी, तो उसमें अगर कोई लापरवाही दिखाई दे तो उस पर कार्रवाई की जाएगी।
Well, Dr. Malik, we played out those reactions with respect to an assurance concerning the shocking case here that has taken place in Farrukhabad. Does this sound as a good enough assurance? Because we are looking at a very basic medical healthcare service that needs to be provided at a hospital to a woman who goes into labor. And to say that we will look into this, strong action would be taken on why this has happened, does that sound like an assurance enough to tell the people that this would mean an upgradation in medical services sometime soon?
Look, the thing is, the thing is, for such an incident, there should be a strong deterrence to the administrators of the hospital and, of course, to the professionals. Right. You know, imagine this is happening in a multi-speciality hospital. It is absolutely careless. It is indefensible. It is a callous attitude, totally insensitive attitude, which should now shake up our conscience. So it is very important that a strong action should be taken against this kind of a medical negligence. That is one point. But my point of concern is something different. This is happening in one hospital. What is happening throughout the country is also very important for us to understand. Unless we improve the infrastructure, unless we increase the budget allocated in the GDP to health, unless we improve our primary health centers, these type of problems will be occurring because there is a big scarcity of, it is just a tip of the iceberg. There might be lot many other females who have also delivered in the corridors of the hospitals and it has not got the attention of the media. So the basic thing is that we should now have a razor sharp focus and try to improve the healthcare of our country. I must tell you, maternal mortality rate and infant mortality rate in our country, although it is less than before, but it is still very much high. You can imagine that infant mortality rate is almost 45 per 1,000 as compared to the developed countries where only 7 children they die out of 1,000. So it is a maternal care is very important and especially the delivery care is very important, not only to take care of the mortalities but for the morbidities also.
That's right.
And it is very important that day-to-day monitoring of this inquiry should be taken so that there should be a deterrence to the other hospitals and other professionals in the country also that this thing should never get repeated.
That's right. Ms. Anila Singh, we're looking at a stronger deterrent, not just a few statements of assurance that inquiry would take place in this case here. What could work on ground as a stronger deterrent? Because we're looking at 2 years down the line for Ayushman Bharat ever since it was announced. We're looking at a year down the line for the Pradhan Mantri SMA scheme, which was specifically mentioned for the benefit of pregnant, expectant ladies. And yet you have this case happening on a big hospital in Farrukhabad.
Sahib, because it is a government hospital, there is a procedure. Whenever such thing happens or any mishappening, there is a procedure and we have to follow that. We have to follow that, and in this case also, inquiry committee was made to inquire that what exactly happened, and that inquiry committee is going to submit its report and then the action will be taken. So, I mean, with any government organization, such a procedure is followed. So in this case also, the inquiry committee is going to submit the report. But yes, indeed, I mean, as Dr. Malik said, that much has to be done in the country like ours, where if we talk about the maternal mortality rate or infant mortality rate, which is much higher in comparison to the developed countries of this world. But if we talk about my government, BJP government, and if we talk about the central government, because of its scheme, if you talk about infant mortality rate, it has dropped from 69 to 37 per thousand. So it is improving, but at the same time, I will say that yes, much has to be done, and the government is very sincere and serious. I mean, if we talk about Uttar Pradesh, Yogi Adityanath ji, we know that day in and day out, he is working for the state only, for the betterment of the state in all fields, not only health, but in all fields. So I am pretty sure about it that such
Malik,
incidents, we are
Dr.
going
Malik,
to see the decrease in such
here is
incidents.
the problem here, because while we're also trying to get in more voices here on this, the nonchalance with which this is being seen, do you feel that from the concerned ruling party, from voices from the administration of the concerned ruling party, there needs to be more outrage towards medical practitioners signed up under government hospitals, PHCs, other health centers, that there is going to be zero tolerance towards this. The very fact that you have a woman who goes into labor, cannot move, has been turned away, and she has no choice. She lays on the floor and delivers on the corridor of the hospital. All right, I'm afraid we're having a difficult time with that line connect. We'll have to leave it at that. It is the end of the discussion. While we've gotten an assurance from the BJP that there is going to be inquiry, there is going to be strict action, there will be further investigation on why this has happened, but this should not be seen as the norm. This should not be seen as the regular, given that this is a specialty health center in the state of Uttar Pradesh, wherein which this case having taken place in Farrukhabad, there is not enough sense on ground that there needs to be zero tolerance. There needs to be zero tolerance on these cases that come to the fore, especially in the wake of several flagship schemes that have been announced by the central government. And as far as pregnant, expecting women there are concerned, they will be provided medical health. They will be provided medical health not just in time, but also in terms of affordability. They will be provided free services if required. Thanks for being with us.